I'm
Okay.
going to introduce you now first in Arabic and then we will proceed in English.
Okay.
Okay, very good. أهلا بجميع الحضور الكريم من العلاج الطبيعي، أخصائيين وكوادر طبية متميزة. معكم دكتورة فرح من مؤسسة سكاي لايف. يسعدنا اليوم أن نرحب بيكم في الورشة العلمية المقدمة من مؤسسة سكاي لايف بالتعاون مع دكتورة سونيتا من مؤسسة بلفيكير لتسليط الضوء على واحد من أهم التخصصات في مجال العلاج الطبيعي تحت عنوان أهمية إعادة تأهيل قاع الحوض. اسمحوا لي أستكمل بالإنجليزي عشان دكتورة سونيتا تقدر تتجاوب معانا بما إن هي صاحبة الشأن. Good evening and welcome to all physiotherapists and medical professionals joining us today. We are thrilled to welcome you to this insightful 2-hour webinar brought to you by SkyLife in collaboration with Pelvic Care by Dr. Sunita Patel. Today we will discuss a highly crucial and specialized topic in healthcare, the importance of pelvic floor rehabilitation. It is an absolute honor and privilege to introduce our distinguished speaker today, a leading global expert in this field, Dr. Sunita Patel, founder of Pelvic Care, Women Health PT, a renowned pelvic floor physiotherapist with over 19 plus years of rich clinical experience, and on top of that, an international educator. We will learn today a comprehensive topic and program, understanding the crucial role and function of the pelvic floor, identifying the specific clinical conditions that benefit most from pelvic floor rehabilitation, exploring evidence-based assessment and advanced treatment approaches, analyzing the profound impact of pelvic health on women across all life stages, and gaining valuable clinical insights through practical case-based discussions. Today's webinar will last from 8 p.m. to 10 p.m. Cairo time, and we invite you to stay engaged and prepare your questions. Now, please join me in welcoming Dr. Sunita Patel. We are ready to hear from you.
Hi, everyone. First of all, thank you so much for having me today and joining me. And I would really love to give my humble appreciation to the whole team of SkyLife who have given me this platform where I can share my knowledge with all of you regarding this pelvic floor. Pelvic floor so far is very underestimated. Like many of the people are suffering from the issue, but a few of therapists understand what the pelvic floor muscle is. So I'm so honored, so thankful to the whole organizing team of SkyLife. They are building this kind of platforms where people like me can share the knowledge with all of you, and we might help the community and the society. So thank you so much, everyone, for joining us, and thank you so much, the whole team of SkyLife, for giving this opportunity to me. Thank you.
Otherwise, we're happy to have you.
Thank you so much. So shall we begin the session?
Yes, of course.
Okay, lovely, lovely. Hello, everyone. There are more than 104 people so far who are joining me today, and I'm hoping that you all are, you are taking your time from the busy schedule. So I'm hoping that you are interested in learning new, updating new about this important topic, importance of pelvic floor rehabilitation. And I will try that after the end of this session, 2 hours, there will be something will be on your side. You will learn, and it might give you clarity that in which cases and how we as a physio can work into help the community into pelvic floor. So thank you so much for joining. And I'm just starting my session. But the question is, can you please keep writing in the chat box how many of you are new into this topic and how many of you are already have this understanding, little bit of understanding, or might be you're expert or you're already working into women's health or men's health or pelvic health. So please give your little bit of kind of introduction into the session so I can understand my audience. But still, we are going to start from the basic. By keeping this, the people might be new also in that, but whoever is expert, always your opinion, your questions will be answered. I will try to help you from my side. So, yeah, I have created one PPT, so which I'm going to share with all of you during the sessions. Little bit of more understanding it will provide you. You can keep clicking the screenshot, whenever you feel that it is important for the practice. So you can always keep clicking the screenshots. All right. So today, let's understand very important part of our life. That is the core or the floor, and this is the muscle which we are talking about today. So this we all are, as a physio, we know that this is the pelvic. I would request all of you to please mute yourself.
Dr. Singh, you are free to share your PowerPoint.
Yes, lovely. Okay, is my PPT visible on the screen? Visible?
Visible to me, yes.
Okay, lovely. So please mute yourself, everyone. We are starting the session. So, as a physio, so far we are working with the musculoskeleton, we are working with cardiopulmonary, we are working with the pediatric population, we are working with geriatric people, we are working with sports rehabilitation, and we are also working into pregnancy, pregnant female, postnatal rehabilitation is also, which has been addressed so far. Can we mute people?
Dr. Sunita?
Am I?
Yes, now you're...
Okay. Okay. So today what we are going to discuss is about the pelvic floor muscle. Okay. And now let me just show you a little bit about important thing. Assume this is a glass. Okay. So in this glass, whenever we are using the word core, so core, the central part of our body, the core. So anteriorly, we are having all abdominal muscles. We have obliques going on. We have transverse abdominis muscle. We have back multifidus. We have spine at the posterior part. Upside, we have abdominal diaphragm. Same way, down of the whole core, we are having the pelvic floor muscles present. So the core is not complete without the pelvic floor. And as a physio, we are always working with abdominal rehabilitation, back rehabilitation, even the breathing, respiratory muscles. But this is the part which is somewhere unaddressed into the community, in our whole community. The reason behind that why that our seniors, our professors, they are not addressing it, this part was, pelvic floor was not a part of the curriculum, is because these muscles are present inside the body and they are lying around the sensitive area of our life. That is the intimate area, private area, which this area we are not comfortable talking about, isn't it? So same way, this whole area, this bone is a pelvic bone, and beneath the pelvic bone, the floor is created by these muscles. So these muscles are attached here below the floor, pelvic bone at the inferior part. So the part between the thighs, you can understand, the part between the intimate area, the part between our panty, these are the parts the muscles are covering. And we are not comfortable talking about this area. That's why even you will be surprised that we have a nerve which is supplying this area, and the name of this nerve is pudendal nerve. And the name of the pudendal is shameful, the nerve which supply the shameful area. So that's why we are not comfortable talking about this. That's how our seniors, our professors, they have not taken this a part of our curriculum, and this important muscle was unaddressed. But The issue is that this is creating the floor of our whole core. So when we say that core rehabilitation, without addressing this muscle, we cannot do the core rehabilitation. So this importance is huge importance. Now, every day, whenever we are standing, assume that when God has created us on our fours. So on that four limbs, so we are using our upper body, lower body, and we have a bigger abdominal muscles which used to work against the gravity. So there was a loaded big muscles, and these muscles were strong enough to have this effect of the gravity, intra-abdominal pressure also. So that was the mainly muscle made by the God. But with the revolution theory, the moment we came on our two, the whole load transferred from the abdominals to this muscle, because now we are into standing. The moment we are into standing from this quadripod to the standing position, the load comes into this muscle, and this muscles became one muscle which has to take load from the up, from intra-abdominal pressure, pelvic organs, as well as from the down, gravity. And initially, in our ancestor times, there was a lot of activities going on whenever we were sitting down, getting up, sitting down, getting up. So this muscle was always getting activated. It was getting relaxed also, and it was functional. But nowadays, you might have seen that so many people, they have issues going on in that area. Now, what type of issue and what this muscle is doing, understanding that is highly important. Now, the whole pelvic bone, and this is the floor I'm saying. So this floor, if I'm attaching a muscle into this floor over here, inferior part, so this muscle is the pelvic floor muscle. The muscle which is attached at the floor of the pelvis is pelvic floor muscle. So this muscle is not a small muscle. You can say that this is pubic symphysis anteriorly, and this is the tailbone at the posteriorly. The muscle is traveling all the way from anterior to posterior. So quite a big muscle. Some people, they might know that we have a levator ani. So one levator ani which supports the organ. So this levator ani. So some people say that we have, if I'll ask that how many muscles are present into pelvic floor, so number can be different. Some people will say it is 4, 5, 6, but it's important that this muscle is not 1, 2, 3, 4, 5, 6. These muscles are right and left, and they are present into pairs, so many pairs. So altogether 14 pair muscle are present into this pelvic floor and one single muscle. So total 29 muscle are present into pelvic floor, and network of these 29 muscles are creating the whole floor and working for that whole health. They work as a core, part of the core, and they function for whatever organs are present into the whole area. So we have 3 organs from anterior to posterior in a female body, and 2 organs from anterior to posterior in a male body. And all the organs like bladder, we have uterus, we have rectum in a female body, they have their canals. So bladder is having the urethra, which is passing through the pelvic floor. Uterus is having the vaginal canal, which is passing through the pelvic floor, and rectum is having anal canal, which is passing from the pelvic floor. So you can understand the pelvic floor muscle is not only supporting the pelvic organs, they are also supporting the canals and the functioning of the canals. We all know that every organ is a part of, like we have excretory system part, we have the, you can say bladder. So if you understand the bladder, which is always holding the urine, it is filling the urine, it is working as a reservoir, and from the kidneys through the ureters, urine keeps coming into the bladder, and we keep storing that urine into this small organ. And this organ is going to work as expand like a balloon, and it will just keep expanding, and it will go from pelvic cavity to the abdominal cavity when filling is going on. And it will keep filling, but once it can't stretch more than that, it will send a signal to the brain that I can't stretch more than that. In this case, its canal, urethra, is going to get relaxed. The moment urethra will relax, we have a muscles around the urethra as a human being. We have these pelvic floor muscles, and our pelvic floor muscles is trained since childhood because we cannot urinate anywhere, anytime. We have a specific areas where we are going for urination. We have our toilets, we have our washrooms where we are going. So till the time this washroom, we can't reach towards the washroom, these muscles keep contracting around this area and they maintain the continence. So these muscles are highly important in human being in our life because we are social animals and we don't want these muscles to behave uncoordinated. So I want to hold the urine, so the muscles will keep contracting and they will maintain the continence. And the moment we will reach to the toilet, this muscle will relax and then we can pass the urine. So you can understand the muscles around the urethra through which the urethra is crossing are very, very important muscles which maintain the bladder health of the male or female both. These muscles are not only for female health, they are equally important for the male health as well, because the voiding dysfunction, difficulty in passing urine is also affecting male. Having the urine incontinence is also affecting male. So muscles are highly important for the bladder health. So now this organ is present into the pelvic cavity just behind our pubic symphysis. So you all, as a physio, we know this word pubic symphysis, a part of the bone, and these are the pubic bone right and left, and we have a symphysic pubic present here. We all can palpate this part, and just behind that part over here into this cavity which is formed by this pelvic floor, this one organ is present anteriorly, most anterior organ of our pelvic pelvic cavity is the bladder, and it is keep storing the urine, and its urethra is crossing through the pelvic floor muscles, you can see. So, and you can see in a male, we have a penile area coming, penile organ is coming out. Through the penile, we have a urethra passing. So that organ is most anterior organ. It can be penile or it can be vulva in a female case. So that's the most anterior organ, and which is surrounding this organ, urethra, we have the muscles attached. So you can see that it is crossing through this deeper layer, and on the top of that, we have middle layer and the superficial layer, which is through which this, you can see this hole is present here in the middle layer, and outer layer also over here, superficial, you can see the hole is coming out. So these muscles are all attached like this. And the urethra is going to cross through this whole area. So these muscles are going to pass. And through here, urethral opening will be visible. Surrounding the urethral opening, these muscles are present. So these muscles are maintaining bladder health. Whenever the brain wants to pass urine, muscles will relax. All the muscles, superficial, middle, as well as the deeper, all the muscles around the urethra will relax and person can void. But in some situations, wherever we have to hold urine, like if the urinal is not present, not around you, and if you want to hold it, you are busy in a meeting. So whenever urgency comes and it sends a signal to the brain, and brain is telling that this is not an appropriate time to void, at that time, this muscles works like a strong, kind of closing doors, and they will maintain the continence, and urine will not come out, and urethra will open, but pelvic floor will not open. So it will maintain the continence. But assume that these muscles, they are the skeletal muscles. So like other muscles of our body, these muscles can become tensed or the muscles can become weak also. Just give me one. The muscles can become tensed and weaker. So whenever muscles are tight, person will feel a difficulty in passing the urine. And whenever muscles are weak, there will be no holding of urine. So person will leak. So urinary leakage, if you just write this word and you try to find out on a Google search, how many male or female, they have a urine incontinence going on in your area, that the result will be surprising actually. 1 out of 3 people, they have somewhere bladder health issues, and these issues can be related to these muscles. If the muscles are tight, voiding dysfunction. If the muscles are weak, there will be leakage, so which is affecting so many of the people across us. Being a physio, we can understand these muscles, we can learn these muscles through different assessment, we have a different approaches, transvaginal, transrectal, vulvar palpation, we can found tenderness into that areas, we can found trigger points, we can found bands formation, we can go inside the vagina, inside the rectum if it is the male, and we can feel the tenderness and the status of the muscle. And according to that, if muscles are tight, we can relax it. If the muscles are weak, we can strengthen it. So you can understand the word Kegel. So Kegel means squeeze the pelvic floor and increase the strength. So the same word Kegel exercise are very helpful when the muscles are weak, but the Kegel exercise are contraindicated, and we cannot use Kegel when the muscles are already tight. So this is very, very important. Simple understanding you can have once you have a detailed, learning about these muscles. So I'll try to give you a little bit more than that, but this is the bladder health. And we as a physio should step forward and start working with urologist. And if the muscles people are suffering from urine leakage, after having, if it is a male or female, for example, male, after having a prostatectomy, prostate issues, there will be definitely urinary bladder health issues, and we can help the person. And same way, when the female is having a weakness around that area or tension into that area, so we can join our hands with the urologist, and we can really support the community. Not only the urologist, as a musculoskeletal therapist, we can also keep that in our mind that whenever our patient is suffering from these issues, we should definitely help the people. And physiotherapy is in some cases, it is a first line treatment. There's a different type of incontinence. It is a stress incontinence. In case of stress incontinence, pelvic floor muscles are weak. Is urge incontinence. So in urge incontinence, nerves are weak. So strengthening of the muscles and working of the activation of the nerves or relaxation of the nerves, what we can do. So we can play a big role here, and it is the first line treatment, pelvic floor. So that is the bladder health. The same way, let me just show you my slide, and you can understand that in a better way. So into this slide, it's not only the part of the core. Anteriorly, we have this abdominal muscles, multifidus, diaphragm on the superior. These muscles are down at the as a floor. So they are creating the complete core, and you can understand muscles are attached from pubic symphysis anterior all the way to the back health. So these muscles are important. They're playing a very big role in maintaining our sacral health, coccyx health, back health, and even the whole breathing pattern, the pressure control, everything. So we are knowing that this is a bone actually, and these muscles I'm talking about, these organs I'm talking about. So this is a fantastic image which will give you a lot of clarity, like how big this muscle is and how important its role is. So this anteriorly, this is the female image where my cursor is moving. Please just put your focus on my cursor. So this is the pubic symphysis anteriorly, and we all can palpate it. It is a landmark anteriorly. Same way, posteriorly, we are having a sacrum, and the last is a coccyx. So this is the tailbone. So these muscles are spanned all the way sides or right side like this, and same way on the left side. So we have a right side of pelvic floor and we have a left side of pelvic floor. Okay, and they're creating a kind of whole floor attaching there around the pelvic bones. They are creating a bowl, or they're creating like a cavity. Into this cavity, pelvic organs are lying in their place with their supportive ligaments. Every organ has their ligament, but organ is supported by the pelvic floor muscle as well. So the first organ we have already discussed here is the bladder. So this is a bladder, and bladder is resting onto the pelvic floor muscle, and its urethra, what is the passage. So after the filling, when the voiding is going to start, urethra is going to relax it, and surrounding the urethra, we have these pelvic floor muscles coming from the right and left side, and they're working like a door around the urethra, and they will help into the voiding or helping into the holding. So this is very important muscles which is playing a big role into bladder health. Same way, if you see, we have another organ present just on the top of the bladder. This is the uterus, and uterus is a part of reproductive health of a female. Any female, we have ovaries, two ovaries present into the pelvic cavity. They keep ovulating, every month. We have egg coming out into the fallopian tube, waiting for the fertilization. So for fertilization, what we need as women, if we really want to become mother, so we have this one canal which is attached with the uterus, and part of this canal is, the name of this canal is vaginal canal. So this canal is the organ which is present into the middle of the pelvic cavity. So this canal, now you see the down part of this canal over here is crossing through the pelvic floor muscle. So now, if the muscles surrounding this canal, if they are tight, very tight or tensed, if they have a trigger point, so they might be having a lot of spasm. So you can say nothing can go inside the vagina. So this condition we are using the term vaginismus, means vaginal muscle spasm, or around the vagina, pelvic floor muscles got spasm or tender. So due to that, the penis cannot go inside, intercourse cannot happen, and if the intercourse will not happen, ejaculation of the sperm will not happen inside the vagina. If there will be no sperm cannot go all the way, and a female cannot get pregnant. So these muscles, tension into these muscles can affect a female in female fertility, and she can't get pregnant. Or the second is, it can be that no penetration at all because muscles are spasmodic. The second thing is, you can understand that it is affecting a reproductive system of a female. So in that case, we being a physio, we should understand, identify which exactly muscles are tight or tensed, and we should be relaxing those muscles with our simple techniques, hands-on techniques, with our hands-on approaches, and by relaxing the muscles, we can help a female into reproduction. So they are very, very important muscle for reproduction, because the door will be closed, you cannot go inside, and female can't conceive, and she can't get pregnant. So it is directly affecting a female motherhood. And the same time, every month, whenever she is having her periods, if the muscles around the pelvic floor, if they are tight, the fascia of the muscle will be tight, it might added up more into the pelvic pain, the pelvic congestion during the period. So female can have more pain during her every cycle. So relaxing of the whole area, whole muscle is very, very important. So these muscles, we really want them to relax whenever we want to have an intercourse, or whenever we want to have a very pain-free cycle. Second, if these muscles are relaxed, the childbirth, after having a pregnancy, during the labor, when we really need the muscles, this whole vagina has to expand, baby will come outside, all the muscles around that area should be relaxed. You can understand that where baby is getting stuck. The labor stage 2 is very long in some females. Sometimes baby is not able to come outside. It can be, and doctor has to do episiotomy. They have to create spaces. Why doctor has to create spaces? What is there in that area which is supporting our female that she's not able to, have a childbirth, normal deliveries, and in sometimes they might have to ended up into C-section also. So over there, the door is only pelvic floor, the muscles. So whenever baby stuck, it means the muscle can be tensed or tight. They are not completely relaxed, or they fail to relax. Baby can descend all the way from uterus by dilating the cervix, and the head can be visible into the vaginal canal, but head is not able to come outside. At that time, doctors are creating episiotomies, midline episiotomy, creating a space, and taking the baby out. Or sometimes if the mother is tired, at that time they are doing doing the vacuum extraction also. So that is the area. If the muscles are relaxed, baby childbirth will be completely smoother childbirth. So this is how it is affecting a female reproductive health. And now, not only the reproductive health, very important part of this area is the sexual health as well. Because when sexual health, for reproduction, we really need a sexual intimacy. So whenever we want good sexual functioning of a female, so her experience should be also good. We don't want to give her a painful experience during the sexual activity. But sometimes, if the muscles are tight and tensed, the intercourse will be painful for her. It can be the horrible experience for the female. It can give her pain, or there might be no intercourse. Sometimes there might be intercourse or penetration is possible, but the penetration will create a stretching kind of pain during the whole act, and that is going to give a kind of a negative impact on a female life about the sexual health. So pain during sexual activity or pain after penetration. So that term we are using here is a dyspareunia. Surprisingly, 40 to 50% female who are sexually active, they experience sexual pain. And when they are having pain during this important activity of their life, so you can understand how it is going to impact her brain and their intimacy and their partner's life. Her approach toward the sex will not be good and positive, because sex is not pleasurable for her. Sex is painful for her. So 40% of female, they have this kind of issues. They are suffering from it. And in that case, most of the time, which I have observed in my practice since last 10 years, that female deeper pelvic floor muscles, levator ani, iliococcygeus, these muscles are somewhere tensed and tight. Just simple 5 to 10 sessions of pelvic floor rehabilitation, and these muscles can live a good sexual life, and they can have a better experience. And so this is that impacting a female sexual health as well. So muscles are present around the vagina, and they need to be relaxed. Same way, if you see the other side of this picture, that the muscles which is around the vagina, if these muscles, because we really want the good strength, because this is the central area of our body. Central area is the vaginal area. And you understand that from the top, whenever we have a pressure going on, abdominal pressure is rising. So due to this abdominal pressure, the abdominal organs are going to put pressure over the pelvic organs, and due to this high intra-abdominal pressure, pelvic organs will pushed downward whenever male or female both, whenever they are sneezing, coughing, lifting, loading, doing strenuous activities, exercise, jumping. So those kind of activities can increase intra-abdominal pressure, and during that time, the all pressure is going to go over the pelvic organs, and pelvic organs can descend down. And if these muscles which is present around that area, if they are not strong enough, so they cannot create a complete closing around the doors. Now, in that case, there might be weakness of the muscles, and due to the weakness of the muscles, organs can start descending down, or the product of that organ, it can be urine from the bladder, it can drop out. This is the stress incontinence. Urine is coming out during the strenuous activities or whenever intra-abdominal pressure is increasing, because muscles are not strong around the urethra. Same way, organs can start descending down from the vagina, or vagina can start descending down. So this is what is the pelvic organ prolapse. Organs can start falling outside during the gravity, all the time gravity effect, and from top we have a high intra-abdominal pressure, which is keep affecting that whole pelvic organs, and it is descending the organs, and muscles are weak. So when the muscles are weak, you can say organs can descend down. So pelvic organ prolapse. Now, how many organs can descend down from the vagina? So you can say that this is the anterior wall of the vagina. Let me just clear it once. Rub it first. Sorry. Okay. Okay, so you can see that this is the anterior wall of the vagina, this is the posterior wall of the vagina, and we have the superior part of the vagina. So now organ can descend from anywhere. So from anterior wall of the vagina, bladder can start descending, falling out, and this is the term we are using, cystocele. Urethra can start falling out, and the term is urethrosil. And the rectum can start falling out from the posterior wall, and the term is rectosil. Uterus can start falling out, utrosil. Sometimes these pouches, anterior pouch, can start falling out. So we can say utrovesiculine fall. And it can be from the posterior pouch can start falling out. So this is a Douglas, pouch of Douglas. So Douglosil. And sometimes the intestines, because on the top of that intestines are present. So these intestines can start falling out, enterosil. So you can understand so many of the areas on the organs can start descending downwards. So altogether, you can say anterior, this is the bladder, urethra, uterus, rectum, this pouch anteriorly, posteriorly, and this whole intestines. So many organs can descend down. So altogether, 7 types of prolapse can be there. Or not only that, vagina can start descending down. So this is kind of vaginal vault prolapse. Vagina is falling downwards. So altogether, 8 type of anything out of this 8 can come out, and this is the pelvic organ prolapse. Now, why the organs are falling out? Because muscles don't have a strength to hold the organ in a place. They are weak and they are descending downwards, and they cannot support the organ. So supportive dysfunction, it means muscles are not supporting, muscles are weak. So in that case, we have to strengthen the muscles. We have to activate the muscles. We have to give them Kegels. So just to try to prevent the prolapse, and if prolapse is already happened, a pre or post-operative rehabilitation is very important, because one thing is very important to understand as a physio, that when the organ is descending down, you cannot fix the organ. They are the structural issues. Structurally, they are falling outside. So you can't fix the structure, but yes, the door, you can fix the door. You can strengthen the door. Once the door will be closed, they will be strengthened, or instead of organ will falling out, they will be inside the cavity. They will not fall out. And so that is very important. The prolapse can happen in this area if the muscles are not strong. And sexual pain or fertility issues can happen if female has a tight muscles. So this way we can help into reproductive health as well as a sexual health and maintaining the supportive health as well. So this is second area in a female body. Last, if you see the third organ, which is now we know that we are eating the food, and this whole after the stomach, the food is going to travel into small intestine. There will be nutrient absorption going on into the small intestine, and after that, the food is going to move. All this excreted product is going to move towards the rectum, large part of that large intestine, ascending colon, transverse colon, descending colon, and after that, stool is going to store into the last part of the colon is a rectum. So rectum is the one organ which is present there, and the function of the rectum is expand to store the feces on the stool. So now this rectum is situated there, and it will keep filling during that throughout the day. And after that, we have anal canal, another canal of the rectum, around 3 to 3.5 centimeter long canal is present in both in the male or female. And this canal is again crossing through the pelvic floor. And we have a muscle which is wrapped around the rectum also, puborectalis muscle. We have muscles around the anus, external anal sphincteric muscle. So these muscles are playing a big role here. So during the filling phase, whenever the filling of the feces is going on into the rectum in both male and female, these muscles should keep closing, keep contracting the rectum anteriorly, keep pulling the rectum anteriorly. So stool should not go downward and should not create a stimulation around the anus, and do not create the stretching of the nerves, and nerves will not send signal to the brain, and female or or male, they will not feel urge. So we have this very important muscle here coming from the pubic bone to the rectum, puborectalis muscle, deeper layer of pelvic floor, which always keep pulling it, lower part of the rectum anteriorly and creating an angle, 90-degree of angle between the rectum and lower part of the anal canal, like this. In this case, you can understand the stool cannot come into the rectum and there will be no urgency feeling person will feel, and stool will keep collecting inside the whole rectum only. It will not come into the anus. So the maintenance of the feeling will be going on. And the same time, we have these pelvic floor muscles, they will keep contracting. The door will be always closed around the anus, door will not open. Okay, and so muscles are strong, then only they can create this endurance, because throughout the day, they have to sustain this action. So we need slow twitch muscle fiber action here. So sustaining endurance. So endurance is highly important. So means strength is highly important. Activation is highly important. So we really want these muscles to be strong around the rectum, around the anus. So they can help into the feeling phase. So same way, if these muscles are not strong, so what will happen? Stool will descend down from the rectum. If this puborectalis muscle is weak, stool will descend down into the rectum. It will stretch out. It will touch the areas around the anal area. It will create a stimulation. The nerves which will get stretched out, they will send signal to the brain that we have a stool around the anus, and brain, this parasympathetic system will get activated, and this anus will open up, and the pelvic floor muscle will also relax, and person will go again and again to pass the stool. So urgency will be there, urgency of passing the stool. Now, in the case, if the external anal sphincteric muscle, the muscle which is around the door here, if these muscles don't have a strength, it cannot sustain the contraction, so stool can leak. So fecal incontinence. I know the fecal incontinence cases are not so huge, but still out of, in their life, approximately every person, they have this kind of issue once in their life. So 10% people in the world, they are suffering from this issue after certain age, mostly after, whenever we have a postmenopausal female, when the hormones are not there, even geriatric cases also. So around 60, 70, 80% can have this kind of stool incontinence and urgency to pass the urgency to defecate. That can happen. So in this case, muscles can be weaker. And not only that, the other side, if you understand that if these muscles around the area is very tight, they fail to relax. So if this puborectalis muscle will not relax, so you cannot pass stool downward, and person will always feel that I feel that stool is there, I feel the heaviness is there, but I'm not able to pass stool. And in spite of the heaviness, the whole bladder will be expanded, and the pressure will be upward pressure, because muscles are tight or tensed. So there will be upward pressure into the rectum. And due to that, the whole colon will be kind of full, and fullness into the whole colon and blotting, kind of gas-like sensation, that person can feel into the whole abdomen. And whenever they will see that in a month, in a week, they might go for passing this stool. They will go for 2 to 3 times to pass the stool, and they will not feel urge also to pass the stool. So you can understand that passing the stool once, twice, thrice in a week is somewhere we are counting it as a constipated. So now newer studies are saying 60% of the population are suffering from constipation. So whenever we say the constipation word, it can be the food habit. Food habit can be one thing, that they are not having a good fibrous food. They are taking too much of protein nowadays, but the other cause can be tight pelvic floor. When patient don't have urge, they are not feeling that they have to go for it. So the puborectalis muscle is not relaxing, stool is not moving around the anus, and there will be no stimulation. So brain will not get that I have to pass stool. There will be blotting kind of sensation. So it's very important for us as a physio to understand this muscle, palpate this muscle through transrectal approach. And if these muscles are tight, we should relax this muscle and help a person in voiding, completely relaxed, full voiding and passing the stool. Sometimes person keep applying the downward force, pressure to pass the stool, but still muscles are tensed and tight, they fail to relax. In coordinated pelvic floor, we are saying it, puborectalis fugus is a term actually. So whenever person wants to pass the stool, the muscles are not relaxing, they create a contraction instead of relaxation. So in this case, patient will keep passing, putting pressure, avoiding pressure, but muscles will not relax. But due to this avoiding pressure, there might be anterior muscles of the pelvic floor, they will get loaded and they might create a weakness. So same person whose muscles are tight around the anus, the muscles can be weaker around the urethra because of the downward pressure all the time person is creating. So you can understand, person can have a mixed type of issues. One area is showing you weakness, anterior area will show you weakness, so leakage is going on, and posterior area is showing you tension and tightness, and there is a difficulty in passing the stool. So mixed pelvic floor condition. Pelvic floor is not weak and pelvic floor is not even tight. One is tight, one is weak. Okay, so anterior to posterior. So this is the very important part here to understand that we have a big role. We should assess these muscles, and the muscles around the anal area, external anesthetic muscles, are very, very important as well, because if these muscles are not strong enough, so understand around the anus, we have the end part of the veins are going, because everywhere we have arteries going on, which is supplying the area. So like assume that heart, from that whole heart, aorta, we have arteries going on around the anal area. They supply the whole 360-degree anal area, last part of the whole excretory system. So we need blood circulation. But after that, veins, which is present there, they are taking deoxygenated blood up towards the heart. So we really need a venous compression. So when these muscles around the whole door, around this whole pelvic floor, this anal area, if these muscles are strong enough, they will create a compression, and because the muscles are strong, they will create endurance, and due to this sustained endurance, the veins will always keep getting compressed, and due to the compression, venous returns towards the heart is going to be faster. It will be good. But if these muscles, external anesthetic muscles, if they are weak, they cannot compress the veins. If they cannot compress the veins, venous return will slow down. And what will happen to the veins? Veins will always have the deoxygenated blood stuck into the veins, and according to the gravity will keep pulling the veins downward, and this is the piles and hemorrhoids. 80% female after having a childbirth, they have these hemorrhoids. So all the people who are obese and the people who are doing the sitting job, sacral sitting job, mostly they are very prone to have hemorrhoids. So you can understand there will be always downward pressure, sacral pressure, and it can be weakness of the pelvic floor. So venous return is not getting facilitated, and it is not getting compressed, and they are ended up into the hemorrhoids and piles. So being a physio, we should understand that if these muscles are weak here, we should strengthen the muscles, and we can enhance the circulatory system by creating the venous compression, and there will be draining going on. So lymphatic draining, venous compression, venous draining, so we can activate that as well. So very important part, these muscles are playing here is a circulatory effect. And we can help into prevention of the piles or hemorrhoids. So next time when you see this word piles or hemorrhoids, so we should always assess what is the status of the muscle. If they are weak, we have to strengthen them. And hemorrhoids can also be due to that tight pelvic floor. Out of this, if puborectalis muscle is tight here, so this muscle upside, if this muscle is tight, person will always apply downward descending pressure, voiding pressure. So due to that, the veins can always be pressed down. They will not compress downwards, and they will fail to take the blood back towards the heart. So again, that can also affect the hemorrhoids. So hemorrhoid can be due to the tight muscles around the rectum, or it can be due to the weaker muscles around the anus. So we should know as a physio that which muscle and how to assess and how to palpate. Okay, and when the muscles are tight, we have to relax, and whenever muscles are weak, we have to give them Kegel exercise. Okay, so this is the role of physiotherapy or role of us in bowel health. We can help a person in holding the stool, we can help the person passing the stool, we can help the person improving the circulation by getting a very good sustained relaxation and contraction around the arteries and the veins. So circulatory effect. So this is the role of physio into bowel health, and we can definitely support the person who has all the time bloating going on, congestion going on into the pelvic area. So we can definitely help them. So you can understand that bladder health, reproductive health, sexual health, and as well as the bowel health, the pelvic floor plays a big role. Now, not only that, the next thing is going to surprise you being a physio, because we always understand that we are working with the back health, isn't it? The spine health. So into the spine, whole spine, the last part is this sacrum. So this is a sacrum, and the last part of that is the coccyx. So what actually happens, let me show you through my model. So this is the last part. Okay, so this is the sacrum and this is the coccyx here. This is the coccyx. So who is have you ever thought that who is responsible to creating the sacrum into this concave shape? Who is attached here? So coming from anterior to posterior, which area is pulling the coccyx inner anteriorly or maintaining the sacral shape? So assume that this is the sacral counter-nucleated sacrum we want. We don't want too much of anterior flexion of the sacrum, and we don't want too much of posterior extension of the sacrum. We don't want that. Otherwise, the whole spine, lumbar area is going to get affected, okay, isn't it? So we don't want this, and we don't want complete of lumbar lordosis. So kyphosis also and lordosis also, we don't want. We want neutral spine. So neutral spine is maintained by the muscles, all this, your thoracic muscle, your lumbar muscle, your sacral muscle, and then downward here is important. We are knowing about all these muscles, but one muscle which we are missing is the muscle which attach with the coccyx, which is keep pulling the coccyx in a right shape like this. Okay, so now see this over here. Okay, so what this muscle, from where to where these muscles are going? So these muscles are going, if I'll just show you from the superior view, muscles are traveling from pubic symphysis, and this is a central muscle, anterior, centrally, more medial muscle, and directly it is going to go after supporting all the canals like urethra. So this is urethra, vagina, and anus. So this muscle is supporting all these three organs, but the muscles are going to go and end up into the coccyx. So this is a pubococcygeus muscle, pubic to coccyx, like a sling. One muscle is coming, one pair of muscle, right side of muscle, left side of muscle, like a sling. It's like a hammock, anterior to posterior. So this muscle is very important muscle which pull the coccyx anteriorly. So if this muscle is over tight, if this muscle is tight, so what will happen to the coccyx? It will be over this kind of concave, isn't it? So the coccyx will be more pulled anteriorly if this muscle is tight, because muscles are coming from anterior to posterior. If tight, it will be pulled over anteriorly. If it will pull anteriorly, so this sacrum S3, S4 will be pulled anteriorly. And person will always complain that I have a sacral pain. And the same way, if there will be too much of anterior pull, so you can understand that this sacrum is going to go for extension. So posterior extension. So this can happen, and a sacral pain and too much of downward. So which organ is present across the whole, the same area? So you can say this is a rectum. So rectum has the same shape of a sacrum. So if that sacrum will be moved anteriorly, so rectum will get compressed from the down. So rectum will be compressed upward. So in this case, passing of stool is going to be difficult. Blotting will be there into the abdomen, and sacral pain will be also present, and coccyx will be more anteriorly pulled. So if the coccyx will be more anteriorly pulled, so what will happen to the door outlet? So this outlet will become narrow because this coccyx is more anterior. It's a narrow outlet. So passing of stool will be difficult, and always ascending pressure due to this tension from the down, always ascending pressure from the down will be there onto the pelvic area. So the organs, the organ which is directly coming into that area, rectum, will be upside compressed. the stool will be upside compressed. So instead of the stool is getting stored into the rectum, it might start getting stored into the colons because of this ascending pressure, which can add up into more anteriorly ascended pressure into the area. And in this case, if it will go anteriorly, so what will happen here? Inlet. So the inlet will become more wider. So whenever the inlet will be more wider, so pressure around towards the organs, pressure towards the abdomen will be higher. So from down to up, ascending pressure, and due to down to up, this ascending pressure, so this pressure can put pressure over the diaphragm also. So diaphragm, which is over that on the top, if this is ascending from here, diaphragm will be also always ascending more. So diaphragm cannot descend completely. It will be stuck somewhere into one position because always we have a ascending pressure going on from the down. This room, assume the room where you are sitting right now. If something is compressed and we have air into this room, okay, assume a balloon, assume this room. If someone is compressing you from down, all the pressure is going to go posterior, anterior, and upward. It will not go downward. So due to that, the diaphragm will also get stuck. So in that case, inhalation or breathing or ascending of the diaphragm will be somewhere hampered, which will create a pressure over the chest also and narrowing of the chest. And you can understand the person cannot go for abdominal breathing because pressure is always ascending pressure. So one muscle, simple pubococcygeus, which is tight and pulling the coccyx anteriorly, can create the change into the whole abdominal pressure and thoracic pressure as well as the breathing of the person. So change into the pressure. What we want with the pressure? Do we want the pressure to shift anterior, posterior, lateral, or superior or inferior? No, we want 360-degree pressure into the abdominal cavity, pelvic cavity, thoracic cavity. But due to this ascending pressure, there will be always upside pressure more, which can hamper your abdominal diaphragm as well as the whole pressure change can be done. Okay, so this is the tension into this muscle. And now, if this muscle, which is pulling it anteriorly, maintaining it this position, stability of that coccyx anteriorly, assume that this muscle is weak, which is very common. So if this muscle is weak, it will fail to pull the coccyx anteriorly. So what will happen to the coccyx? Coccyx will be not pulled anteriorly and it will be fall back. So once the coccyx will fall back and the person will sit down, he may always keep feeling this, that I have a pocky pain, tailbone pain, and this is coccydynia. So that can be when the coccydynia is not only after that something happened with the coccyx. Coccydynia can be due to the pelvic floor muscle fail to pull the coccyx anteriorly. They are weaker and the coccyx is falling backward. And the coccydynia will be there, and you can understand the change over the sacrum. So sacrum anterior flexion. Sacrum will go for anterior flexion, which will give the lumbar lordosis to the person as well, anterior pelvic tilting, weakness of the abdominal muscle, back pain, and coccyx pain. So first will be coccyx pain, slowly there will be lumbar lordosis, and third, anterior pelvic tilting. And that can create a weakness of rectus abdominis muscle. And in this case, you can understand what will happen to the pressure. Pressure will be descending pressure, downward pressure. So leakage of stool, leakage of urine, prolapse of the organs. So in the coccydynia. So this is whole back health correlation with the pelvic floor. So without addressing pelvic floor, you can understand we are missing a lot into, and after adding this, understanding this, we can add into bowel health, bladder health, sexual health. You can understand the whole reproductive health, because you can understand in a male, if I'll just show you the male image. So into male also, this is a penile structure. Okay, so around the penis, these muscles are attached. We call it as a bulbocavernosus muscle, ischiocavernosus muscle. So these muscles are very important. They work like a ring at the base of the penis. So if these muscles are strong, they can maintain, because whenever what is the erection? Erection means the blood comes into your cavernosas and the penile cavernosas are getting filled up and they are expanding. This is erection. But if the blood is coming, so what we want, arteries are bringing the blood, but at the same time, we don't want the veins to take the blood back. So that's why God has given us these muscles, bulbocavernosus muscles around the base of the penis. What they do, they create a compression because they are strong enough. They will hold the base of the penis like a ring, and they will create a compression over the veins, and veins cannot take the blood back towards the heart. So venous return is somewhere prevented by these strong muscles around the base of the penis. So erection is happening due to the ischiocavernosus muscle around that area, which is pumping blood towards the penis, and blood is maintained into that area. Erection is maintained due to this bulbocavernosus muscle. You might have heard about erectile dysfunction. So erectile dysfunction can be due to several reasons. There can be 4 reasons. One is a heart health. Your blood is not there to come into, the feeding is not going on. Your hormones are not active. Brain is into stress. So hormones, blood. Second, the veins. Veins are not, they are over dilated and they are not getting compressed by the muscles. So muscles plays a big role here into erectile dysfunctions. 40% female after the age of 40% male after the age of 40, 50% male after the age of 50, they are suffering from erectile dysfunctions. And you can understand the change into the whole pressure. Whenever muscles are weaker, there will be pressure system change, downward pressure always, which will always keep weakening this muscle. Whenever person is obese, the muscles can be weak. Whenever the person is doing a lot of core workout, tight core, the muscles can be tight. So understanding of the system can help a person whole body, whole core, bowel health, bladder health, sexual health, add up into the reproductive health. And you can understand this kind of, the unheard, like discussed word, erectile dysfunction, vaginismus, sexual pain, chronic pain, ejaculatory pain, premature ejaculation. So all these things we can understand once we understand these minute, simple muscles. So you understand the importance of this floor. They work as a supports the organ. They work around the canals, sphincteric action, closing opening, so you can hold and you can pass. So we need an endurance for that. They do the circulation, so we need a fast twitch action also, so they can provide circulation, venous return, so circulatory action. They create a stability bit around the pubic symphysis to the coccyx. Not only that, I forgot to mention another important muscle here, which is coming from one side of ischial tuberosity to other side of ischial tuberosity. I think you have, about this word pubic arch angle. So we have this pubic arch angle, which is normal in female. 90-degree pubic arch angle is normal in female, and 70-degree pubic arch angle is normal in male. So who is responsible for creating this pubic arch angle? Why these ischial tuberosities are into the same area? Why this angle is maintained? This angle is maintained by one muscle, which is coming from ischial tuberosity and going into this part, superficial transverse perineum, deep transverse perineum. We have 2 muscles, right and left, 2 paired muscle, altogether 4 muscles. So these muscles are maintaining the stability of ischial tuberosities, and the angle will be 90-degree in female, angle will be 70-degree in male when these muscles are active. But if this angle is more than 90 in a female, for example, 110, 120, so what will happen to these muscles? They will be loose. That's why they cannot, that's why this angle is more, because muscles are weaker, saggy muscles, loose muscles, weak muscle. So angle will be more. So if the angle is more, so how it will affect us? You can now check here. If this angle is good, so pubic symphysis over here, anti-superior, look. If angle is maintained, there will be nothing is going on over the pubic, pubic bone, right and left. They will be completely secured. But the moment the angle will be more, can you see the space increased here, the lower part? It can give mons pubis pain, round ligament pain. It can give her clitoral pain. In male, it can give that sexual pain. So because there is a spacing increased here. Okay, and due to that, narrowing will be there, tension into the abdominal muscles, and this will become narrow, and the outlet will become bigger, and descending of the urine, because urethra is the more anterior organ, so that bladder will keep compressing downwards. So urine leakage can happen, prolapse can happen, and this outlet will be more outlet when this arch is more. So one simple muscle, so two simple muscles, superficial and deep transverse perineal, which maintain the stability of this ischial tuberosity, are highly important. Not only this sexual anterior bladder health or this pay anterior muscle, you can understand the impact of this muscle on the back. So if you see, we have these two SI joint, right and left. So whenever the angle will be high, look, angle is more. So the moment angle will be more, what is going on with the sacrum? Look, you can see little bit of instability over the sacrum. So sacral pain will be there, back pain will be there. Always keep telling that I have a piriformis pain, I have back pain, something is like some nerve compression. They always keep feeling. They will be, and understand this ilium will come forward together. So inlet will become narrow. And the side oblique muscle, external, internal obliques, they will become tensed, and person will have ASIS pain, PSIS painful, ilium will be congested ilium. In this case, anterior posterior diameter will become high and lateral diameter of the abdominal will become narrow. So pressure will again change and outlet will become big. And you can see pain will be at S2, S3 here. Piriformis will be always tense. Okay, and two side of pain. And if this muscle, other side, if this muscle is tight, for example, this superficial transverse muscle is tight, which is very common after having an episiotomy, childbirth, C-sections, childbirth scar over here, perineal tear or episiotomy, the scar. So due to the scar, due to these stitches, scar will form, adhesion will form. So what will happen to these muscles? They will become contracted, contraction formation. So they will become shortened. So due to that, this ischial tuberosity will be pulled to each other. So the moment they will be pulled to each other, so you can understand narrowing of the outlet and pain around here. These female will be present with the diastasis recti below than the umbilicus. So how they will affect the weakness into the abdominal muscle, higher ascending tone into the abdomen, as well as understand what will happen to the back. So the moment it is narrow, so look at up here, the normal. Okay, and now let me just create a narrowing of this muscle, mild narrowing. Can you see space increased? SI joint pain. So this is the reason why after having a childbirth, stitches on the perineum, female is very prone and very common back pain, back health issues. So now this minute muscles provides a big stability to the whole pelvis, strong support to the organs, good compression, pressure maintenance. And if the muscles are good, abdominal pressure will be good, back pressure will be good, ascending pressure over the diaphragm will be good, the whole pressure will be maintained, health will be good, posture will be good. But unfortunately, we don't understand that. We don't have that kind of more deeper knowledge. I have used some words here, bulbocavernosus, ischiocavernosus, puborectalis. These are the name of the muscle. And I hope that today was the session where we really wanted to have importance of pelvic floor, that understanding. And but yes, definitely in future we will dive deeper into those muscles. So altogether 14 paired muscle and one single muscle. We will understand each and every muscle, which muscle is present around urethra, which is around the vagina, which is around the penis, which is around the scrotum, which testes, which is around the anus, which is around rectum. So we will understand every muscle in our further future learning programs. But my motto was today that we are missing a lot. Without adding this into our training, you cannot treat a person who has a back health issue. Understand when this muscle is weak, so always descending pressure will be there. And even the knee pain, you will be surprised that I have seen so many of my patients who has knee pain and the medial ligament pain is there. So you can understand that way pelvic floor muscles are weak and sometimes pelvic floor muscles are tight, which is all changing their center of gravity, their positions, how they are walking. There's a tension of obturator internus, adductors, they can become tensed and they can change the pattern of the walk, gait pattern, that can load the whole lower limb. Same way, the pressure which is ascending pressure, it can affect the diaphragm, the breathing pattern of a person, restriction of their shoulder. So pelvic floor is the core, it's the center of the core. We have up body, half body up, half body down, and that's the central part. We have one body right and left, and that is the central part. So much is we are missing as a physio without addressing this important muscle. So I hope that you got this understanding that how important learning about that, and I'm hoping that in future, I'm not saying that learn from me, you can learn from anywhere, but learn, explore. There are so many articles, books available, or we are also coming up with whenever in next time learning programs. So you are free to join us. Thank you so much, everyone, for joining me. And if you have any question, any concern, you guys can connect with me. Thank you.
Thank you so much, Dr. Sunita, for being with us here today and teaching us more about our role in pelvic floor rehab, and as well as bowel health, bladder health, and much more than we would have thought. And here's a certificate of appreciation, and we thank you for taking your time and teaching us today.
Thank you so much, Doctor. Thank you so much, the whole team of that Sky Life. I'm so blessed.
Thank you so much. We will have an online in July, an online workshop. Is that correct? Correct. The continuation of the pelvic rehab series, and the online will be 5 days before the hands-on workshop.
Yes.
Which will be on the 23rd and 24th of July. Correct?
Yes, ma'am.
Yeah, we invite everybody to attend and join us in order to complete this series and have an all-rounded experience of our pelvic rehab and all of the content.
Thank you so much, everyone. Thank you so much, Farah, Dr. Farah, and the whole team of Sky Life for having me today. And thank you, everyone, for joining us.
One last announcement we would like everybody to hear, and you, Dr. Sunita, on the 25th of July, on the 25th of July, we will hold the first International Congress of Pelvic Floor Dysfunction under the title of Pelvic Health Beyond Boundaries, and we would love to have you. And I will say that in Arabic in the end, and you will have a workshop, private workshop in this conference as well for you, Dr. Sunita.
Thank you so much. Thank you so much. I would love to attend that. Thank you for the opportunity.
And details will be held later on. يعني هنقول لكم التفاصيل كلها بعد كده، هنعلن عنها. لو حد عنده سؤال يكتب في الشات. I just told them if they have any questions, they can type them in the chat.
Yes, lovely. I'll wait for that.
So someone is asking about a recommendation for a book or a reference to study from.
Yes, I just had wrote one. Therapeutic exercise for the pelvic floor, author Kerry. They can go for.
Okay, great.
Pelvic floor re-education is another book, or I'll just send you some reference. You guys can share with them. References and the techniques we can use. There are techniques like, there are scales to assess the muscles. There are questionnaire because we need to take a detailed history from the patient. So we have a questionnaire related to the bladder health, bowel health, sexual health. So you can write down that bladder health questionnaire on the Google, and there will be so many incontinent societies. You can go through that and download their forms. Forms are available online for the bladder health. Same way, female sexual functioning index (FSFI) is another form for female sexual health. You can download that also. It is free available. Another scale is MSFI, male sexual functioning index. You can download that as well, available onto the Google. And bowel health constipation scales, constipation questionnaires are also available. So just write it down: questionnaire related to the bladder health, sexual health, and the bowel health. You will get it. You download them, go through them, and this is going to give you clarity that what type of questions you should ask from your patients. After that, there are scales. So because whenever patient comes to you, you need to assess the patient, that is it a tight pelvic floor or is a weak pelvic floor. So for that, normally the symptoms of the patient is going to tell you. Whenever they have a pain, they have a tension, tightness, difficulty in passing, urine, stool, or having a sexual activity or back pain. So we can understand patient can have a tight pelvic floor. Whenever there is a weakness, difficulty in holding the urine, holding the gas, holding the stool, prolapse are going on, laxity is there, erectile dysfunctions are there, so we can understand patient is having a weak pelvic floor. So whenever patient has a tight pelvic floor, relax that. All the stretching exercises, adductor stretching, all the pelvic area stretching, we have to work on to these muscles. Deep stretching exercises, deep squats, lunges, you can give that to the patient. But to stretch the pelvic floor, assess the pelvic floor, you really need hands-on skill. You need to understand the muscle, you know the names, from the orientation, from where to where they are going, the fibers arrangement, then you can palpate them, how to palpate, how to assess. So that really requires that kind of skillful training. But still, you can always, whenever muscles are tight, to give them stretching and relaxation or heating, that kind of just to create a relaxation. And whenever muscles are weak, you can go for a strengthening protocol, adductor strengthening, glute strengthening, all the associated muscle, accessory muscle strengthening, core strengthening, breathing work. You can give them Kegel exercise, squeeze your stool, hold your gas, hold your urine. That kind of command we can give them. We have a scales for relaxation, which is just published. I have published that scale because in the world, there was no scale which was giving how to assess the relaxation of pelvic floor. Because every time, being a physio, our mind is always working on to the strengthening, how to strengthen it. So that's how, for the strengthening, how much weak is the muscle, we have a scale, MMT. So manual muscle testing scale, the Oxford manual muscle testing, everyone is using as a physio. In pelvic health also, modified Oxford MMT scale, the whole world is using. But we don't have any scale which tell us that how tight is the muscle, how much relaxation we require into this area. But because if you cannot insert your finger inside the vagina, inside the anus, you cannot assess the strength. So very important to have a relaxation scale into the pelvic floor. So I have published one scale in India, pelvic floor muscle relaxation scale. I will send you, you can get that on Google. You can just write down my name, Dr. Sunita Patel, relaxation scale. You might found it. It's very easily accessible. You can download it and you can just go through that. You can understand that according to the scale, what is -1, -2, -3, -4, -5, and you can understand your patient as per the symptoms, which muscle is tight and how much is the tight, okay, and what the person requires. Same way, for contraction test, we have a MMT, Oxford MMT scale. We also have another scale, perfect scale, into perfect, PERF. So P means power, check the power of the pelvic floor, check the endurance of the pelvic floor, check the relaxation, that repetition of the pelvic floor, and check that fast twitch contraction of the pelvic floor. So perfect scale. This is all you can learn whenever you will go more, you dive deeper into the pelvic floor. And according to that, if you found muscles are tight, relax them. If muscles are weak, you activate them and strengthen them. If there is a neurological issue, so we might have to work with the nerves as well, nerve stimulations. You might have heard about EMG biofeedback, EMG TMS, transvaginal electrodes, transrectal electrodes, using TENS, IFT. So this is also very important to understand, but you can always use that when you understand the deeper insight. So thank you so much. So that was just simple from my side. There are some other questions. Why are women more prone to incontinence if they have more muscles around the urethra? Okay, because as a women, we are getting pregnant, and we are all 9 months, our uterus is big enough, and we are carrying a heavy weight of the uterus, and the weight are falling directly onto the pelvic floor. So pelvic floor becomes stretched out for the another, like, if the uterus is getting bigger on 3rd month, so 4, 5, 6, 7, 8 times, so another 6 months, the pelvic floor will be loaded and it relaxes its tone, so it become weaker. And during the childbirth, when the baby is coming outside, baby comes out from the vagina, and we have a right side and left side of muscles around the vagina. Mostly they go for separation. So altogether 85% pelvic floor muscles are going for separation during the childbirth, which is leading to the scar tissue formation and tension and tightness, as well as weakness, because the tension is not a strength. So the muscles will be tensed as well as weaker as so the more pregnancies female is getting in her life, more loaded the pelvic floor will be, and after that many deliveries from the vagina is going to create more weakening and a kind of separation of the muscles, loosening of the muscles. So muscles are not strong enough, and they are putting directly load on the bladder health. So that's why female are more prone to have incontinence. And the second thing is our bladder and specifically our urethra and pelvic floor, they have a estrogen receptors. Female life is always up and down according to the hormones. So whenever estrogen level is going to go down, the strength, the tone of the vagina, the tone of urethra, the tone of pelvic floor, and the tone of whole skin is going to go for sagging. So you can understand the muscle, the tone will not be good. So you can they will not be able to create a good action. So that's why after postmenopausal time period, female are more prone to have prolapse, leakage, because the hormones are affecting it. And the third is relaxing hormone. During the pregnancy, we are having this relaxing hormone, and this relaxing hormone is not affecting a male. So it is not there into the male. So male is not getting pregnant. So there is no load onto male pelvis. They are not delivering a baby. So no damage to the pelvic floor, and they don't have a relaxing and estrogen receptors into the pelvic floor. So our hormone, our reproductive health is more prone to have affect, pelvic floor is that area. And on the top of that, sometimes we have to carry the baby, we have to load the baby. Baby is 2 kg, 3 kg, another 4, 5 to 6 months, 6 years after having childbirth, we have to carry the baby. So that is always keep increasing the intra-abdominal pressure, which again put a load onto pelvis. That's why postnatal rehabilitation, which is missing, is highly important. Okay, I'm sorry, something happened in my keep moving the camera. All right.
Okay.
Yes, so another question is, doctor, for men, do they have to routine test for training pelvic floor muscle gradually for middle age, or what about that? Okay, for men, yes, for you always ask for the symptoms. Whenever we have a weak core, obese people, weak abdominals, you can understand that they might always have a weaker pelvic floor. When they have a back health issue, so definitely the pelvic floor will be also affected. So keep asking them questions. Do you leak? Do you have a constipation? Do you leak? Do you have a difficulty in passing the urine? Do you have a difficulty in passing the stool? Or you can also ask them the question related to their sexual health, that is erection is still possible. You can ask a simple question that what about the morning wood? So if the person, because morning erection, male are having morning erection once their hormonal loop is fine, their testosterone level is good, nitrous oxide is good, circulation is good, so they will always having the morning erection. So that means, and that morning erection is there, but during the erection, if they are doing that intercourse, if they are not getting erection, they might be pelvic floor muscle. So we should definitely ask this kind of question, but they might need a kind of more detailed understanding for all of you as a therapist. How can we deal with the case of anismus and also pelvic floor descent at the same time? Yes. So anismus is a tight pelvic floor. It can be tight puborectalis muscle, or it can be tight external anasphinctic muscle. So anismus, spasm of the anal muscle. So now the rule, what I always feel, and the other thing you're asking, the descent, pelvic floor is descending. So in this case, pelvic floor will descend from anterior aspect, anteriorly. So the principle is that whenever you found that one part is tight and one part is weak, do not start working on to strengthening. You first relax whatever part is weak, tight, you first relax that part. Once they will be equal, when it is relaxed, then you start working on to strengthening. So relaxation, then activation, and then strengthening. Follow this protocol. So the part which is tight will relax that, and after that, relaxing it, we will start working on to the strengthening. Ma'am, share videos of, okay. Okay, all right. There are some videos on my YouTube, free videos about Kegel and reverse Kegel, Dr. Sunita Patel YouTube videos. You can just go through that and you'll get more more learning about what is Kegel exercise and what is reverse Kegel. Enlargement of prostate lead to overactive bladder in men 65 years. Enlargement of prostate means the prostate is going to go for swelling. Whenever that is going to go for swelling, you understand what is going on with the area. Area is going for stretching. So all the prostate is below, lower part of that. Let me show you the prostate. So this is the prostate. It is the lower part attached with your bladder. So if this organ is going to go for stretching, so that all the nerves which is present here, they will be hyperactive. So when they will be hyperactive, hyperstimulated, they will keep sending signal to the brain whenever you will start getting filled up here. So brain will always keep sending to the person to void, because I have urgency will be high because nerves are overstimulating in case of expansion of or over enlargement of this prostate. Okay, so prostatitis, inflammation of the prostate or enlargement of the prostate, they can always affect the nerves, which is because they're very closer organs to each other. Okay, so that these downward nerves will get stretched, and this is the only downward part which is going to get filled up with the urine. So they will keep sending signal to the brain that I have urine and I'm getting stretched. So sympathetic system will be overactive, okay, which will activate the parasympathetic system. Enlargement of, okay, which universities you are suggesting to us to having masters and PhD for women health? Dear, whatever is possible in your country, you can go for it. There are so many universities nowadays, they are having these plans. They are planning masters as well as you can go through it. But normally, if you get a chance, because in Egypt also we have, I'm not that much aware about, but if you are asking me, you can, the good countries where you should move for having your masters in PhD in women health will be USA and Australia.
Thank you so much, Dr. Sunita, for taking your time to answer our questions.
Sorry, doctor, there's another question from Dr. Ala Khalid. May again how pelvic congestion happens and what its symptom. Pelvic congestion means tension into the pelvic cavity. The inlet will be congested. So whenever inlet, so means always ascending tone into the pelvic floor, hypertonous pelvic floor, tight pelvic floor. So it is not able to move completely freely. All the organs, their arteries, the lymphatic system, their veins, they will not be free to work. So they will be congested, tensed. This is the pelvic congestion syndrome. Everything is congested. So for that, we need more mobility, more space, more stretching. So external obliques, internal obliques, pubic symphysis, sacrum, ilium, they should be movable 360 degree, if you and including the pelvic floor muscles. Thank you. Thank you so much. Yeah, Dr. Farah, you were saying something.
I guess there are no more questions. Okay. So as we said, I'm going to say that we have the Congress on the 25th of July, and I just will announce it in Arabic again, so that everybody's attention yeah, so that everybody gets it. هيكون في كونجرس يا شباب، أو يعني مؤتمر مصغر كده عن مشاكل قاع الحوض بعنوان pelvic health beyond boundaries يوم 25، وهيبقى فيها ورشة خاصة لدكتورة سونيتا. فاحنا هنوفيكم بالتفاصيل كلها يعني بعدين برضو. ويعني بندعوكم للمشاركة في المؤتمر ده والحضور بورشة دكتورة سونيتا إن شاء الله. الشات برضو بعتنا فيه التفاصيل لو حد حابب يقراها عشان تاخدوا بالكم منها. Thank you, Dr. Sunita. That's all for it. That's it today, and thank you for your time again, and also taking your time in answering the questions. And this was today's fruitful workshop and webinar. And thank you so much for for being here. And that's it.
Thank you so much. Thank you so much for having me. Thank you for this platform. Bye, everyone. Thank you. Bye.
Bye bye.